Well, ladies and gentlemen, our very first presentation is a spotlight on a service, and the service is the Concord Burns team, a team that are ready to serve 5 million people across 11 different local health districts and the ACT. We're going to tell the story of the Burns Unit, or part of their story, in 2 sections, but what will unite the 2 sections is the value of a multidisciplinary team, the critical nature of time when it comes to people with burn injury, and the remarkable power of partnerships between clinical teams and families. Just to begin, take a look at this short video.
My name is Andrea Christina Isler-Fisher, and I am the Burns Fellow at Concord Hospital. Just always knew that I wanted to do burn surgery. I think my inspiration were my parents, who both have a very meaningful job, and it's very important for me to have a job where I can make a change and make a difference. The skin is the body's largest organ. It's also the connection, obviously, from ourselves to the outside world. It's what people see from the outside. If we actually can change a person's life and help people and get them back on track, back to their normal life, that's a very good feeling. It's very exciting to be a member of a team which does treatments which are cutting edge, and we as a team were able to provide this service to a patient, and the first patients came back and say like, oh, this was fantastic, and that was one of the most rewarding moments in my career in the public sector. Ultimately, it's all about the patient's end result and outcome, being in an environment of people trying to achieve something for the greater good. I believe a lot of people in the public sector have that way of thinking. I like going to work, I like what I'm doing, and I'm passionate about my profession.
And I just want to comment that Dr. Isler-Fisher falls into that small category of people who look good in scrubs. Ladies and gentlemen, it gives me great pleasure now to welcome to the stage Professor Peter Mates, Head of Department and Chair of Burn Injury and Reconstructive Surgery at the University of Sydney, and Dr. Karsoon Lim, anaesthetist working in the Concord team and Senior Lecturer at the University of Sydney. Please make them welcome.
Morning, everybody. My name's Peter Mates, and I stand here representing a very large group of people, one of which you just saw on the screen, and she's here today. You'll be able to talk to her a little bit later. I thought that I bring along with me one of my anaesthetists, because I think what we do is not connected to one person but to a team, and the people who are never seen in that team are the people who actually keep our patients alive, the intensivists and anaesthetists, and you will hear a little bit later what Karsoon's vision enabled us to do. 2 facts about burns. If it's deep and big, it will scar a lot. And a little bit later you will hear from a patient that you saw earlier, Angus, who falls in that category where it was deep and large, and I hope that he will have a meaningful and normal life because we were able to put it back together. But it's not only the skin that is affected. This is a systemic disease. There is a thing called burn disease, and it's not just an injury. It can affect the entire body. And if we are not able to do what we do early on and immediately with the help of people who understand this, then the best bioengineering and surgery will ultimately fail. What is burned cannot be unburned. We are dealing with an injury that we are dealt with upon the admission of the patient. We cannot change what has already been damaged.
Excuse me, Doctor, I'm sorry to interrupt you. I just meant to say that in the presentation there are a couple of images that show burns, but we see recovery. But you'll just let us know and they can close their eyes if needed. Thank you.
So when we get the patient, we cannot just reverse what happened, but we can stop and influence that it gets worse. We can reduce the need for grafting, and with that we can reduce the need for permanent scarring. We can also reduce the life-threatening conditions that these patients go into. And this is what a multidisciplinary team is all about. we can do this best if we get the patient early. And I will tell you what happened to Angus in a little while.
So this was a patient who came to us, and it changed how we manage and approach big burns. So this was a 48-year-old female. She was a cleaner who worked in a caravan park in snowy mountains. She went to clean a caravan. There was a leaking LPG gas cylinder, and she turned on the light, and the whole caravan exploded. It was destroyed, and she was ejected as part of the explosion. She received burns to 40% of her body, and they were quite deep burns. She was conscious at the scene. There were bystanders in the caravan park, and they placed her in a creek to provide first aid to cool the burn. Now remember, this is in the snowy mountains in the middle of winter. Care Flight, the aeromedical retrieval team, was called. They intubated her at the scene and retrieved her to us at Concord Hospital. So she arrived in our intensive care at 6 o'clock on a Friday evening. The explosion happened at 2 o'clock in the afternoon, so she got to us within 4 hours of her injury. This was the coldest patient I've ever seen. Her temperature was 31.9 degrees. It was incredibly cold. When you get a big burn, the entire body goes into shock. You lose fluid from your blood vessels, you start to swell, you become hypovolemic, you go into acute renal failure. And to prevent that from happening, you need masses of intravenous fluid. We calculated that this lady needed 12 litres of intravenous fluid to be given to her in the first 24 hours. And she was well behind that. So her blood volume had gone down, and she was developing acute renal failure. We had no blood tests on her, we had no x-rays, we had very little information on her, and she arrived in quite poor condition. And we did something that we'd never done before. So what would normally happen in these patients is they would come to us and they would be stabilised in intensive care. They would get the massive fluid resuscitation to try and prevent them from going into shock. They'd be investigated, they'd be warmed, and once they were better, they would then go to the operating theatre to start the process of grafting and debridement. But this time, we took her to the operating theatre within 1 hour of her arriving at Concord Hospital. We had no blood tests, very little was back. She was still cold, we were very behind. And what we did was we debrided. We did a very vigorous scrub of her burns, and we applied Biobrain, which is the dressing that you saw before. We'd never done this before, to do this as part of the initial resuscitation. As part of the anaesthetic, we continued her fluid resuscitation, and we continued to warm her while the surgeons applied their Biobrain. So this is the patient afterwards, and you can see the synthetic dressings that have been applied to the burns on her legs. She was returned to the intensive care after the operation, and what was really surprising and practice-changing for me was that we almost essentially turned off the massive systemic inflammatory response that she got from the burn. She didn't develop any acute renal failure or any other organ failure. She didn't need inotropes to keep her blood pressure up. She didn't go into shock. We thought that she would need 12 litres of IV fluids, and she ended up needing only half that because the inflammation was reduced by getting these dressings on her early. She got out of intensive care on day 4. Down the track, she had 1% that needed regrafting, only 1% after having a 40% burn, which is really impressive. And she was discharged home and well within 24 days of a very massive and significant burn injury.
Thanks, Kasun. I think this is a perfect example of what happens in a team that I honestly don't think that there's any anaesthetist that I've ever worked with who would have trusted me enough to say this patient needs to go to theatres now, and normally I hear no, we can't. And Kasun said yes, we can. And it's an expression of trust between people that work together, that know that when we discuss things, we mean it. There is a possibility to do something, to go from this phase to the phase that this lady now has, living normally in the community and being able to work normally with her hands that are fully recovered. It is part of what this is all about. It is part of people talking to each other, exchanging information, learning from each other, and working together. So conclusive is that we can change things. We cannot unburn people, but we can reduce the scarring and with modern technology influence what the patient is left with when they leave us. And, you know, part of a team as the leader of that is to integrate all these people and work together like Kasun, and then you will hear a little bit later from Andrea that you saw on the video before, who now specializes to try and reduce the permanent scarring with laser technology. We can make a difference, especially when these patients come to us as early as possible, and all of you who are in the health system, I'll urge you, when you see patients like this, pick up the phone and give us a phone call. Simple conversation, it may change the person's life. Like what happened with Angus, who was injured some years ago in the ACT and came via Canberra Hospital to Concord Hospital in less than 24 hours of his injury and was in the operating room in less than 36 hours with a life-threatening condition on a breathing apparatus, and he can now here be with us today with his family living a normal life. Thank you.
Thank you so much, and I'd now like to invite Angus and his family to come and cluster here, and members of the Concord Burns Unit who worked with him to cluster here. And I've asked them to put on scrubs because my background is in theatre. If the family could come here, and Angus, if you could come forward. And what we're going to do, ladies and gentlemen, we can't tell this story. This is a massive story. Angus is still receiving care. We're going to give you snapshots. Come forward, love the audience. And we know that you can put together the snapshots from the context of the story. Angus, can you come forward, mate? I'm going to focus with the whole group on what made it possible for Angus to survive and get well. He was sitting around a bonfire, he was studying veterinary science, he was in Yass, ba-boom. And the family are up in Queensland and they get a terrible call from the police that no parent ever wants to get. So the question everybody's thinking about is what made it possible for Angus to survive and get well, and for those of you who were here earlier, become a barrel boy in a lucky dip drawer. First of all, where are you up to in your vet studies?
I'm halfway through, so 3 years into it.
And when you were so badly injured, was that part of what you were thinking about? Am I going to be able to have a life, be a vet?
So yeah, that was the main concern, getting back into everyday life.
If you could all speak up a bit, you know how I'm throwing my voice out, that would be great. One of the things you said you think was made you survive was the passion of the team. They seem pretty passionate, those two blokes. What do you mean by the passion?
They are. So everyone has a genuine interest in seeing the very best. And everyone wants you to, you know, to get back out there, carry on with your life.
How could you tell?
It was, you know, the smiles, the compassion, you know, everyone was keen to get in there, get the job done, see you later.
You look gorgeous, right? As I understand it, if we asked you to take your clothes off, which we're obviously not going to do, you still do have some injuries, didn't you? I think you had a ton of staples in your back and stuff.
Yeah, so I was 40% thickness. Quite lucky though, so I can nearly get away with shorts and a t-shirt and nothing would be visible.
Innovation. You actually, I swear to God, I didn't word him up. I said, what made you survive? He said, the first thing came out of your mouth was innovation. What do you mean?
So it's a field that is constantly striving. You know, near enough isn't good enough. And they really, every day was different. So from dressing changes to surgical techniques, it was really trying to push the field further and further and further.
Can I just get over to your mum? Do you remember getting the call? I have to ask you. I have kids and, well, can you remember the call?
I do remember the call, and as soon as that phone rang, I turned to my husband and said, I hope that's not one of the children. That was my immediate words.
I'm going to ask you to hurl your voice to the rafters, okay? You told me that Concord feels like a country hospital with the expertise of a city hospital. What do you mean?
It's a hospital where I felt very comfortable. People came to know us as a family and individually very quickly. It feels like a big country hospital in a major international city with international medical expertise.
But why did it feel like a country hospital? Give me an example.
Well, for a start, it's not a big hospital. Geographically, 2, 3 main buildings, easy to get around, and we were able to actually live on the hospital and be literally, I think I counted 70 paces between where I was staying in the old nurses' unit to the lift, the elevator that took me to Angus.
70 paces to your son. I love it. You can count them. And you said swift action was key to his survival. Tell us.
Very swift. As Angus, from what I understand, because we weren't here in Sydney, as soon as he arrived here, straight into ICU and was on the operating table the very next day.
When you first saw him, what was that like?
Shock. Absolute shock. Almost unrecognisable. The edema blew him up, like he was so swollen and so... But, you know, he still managed to give us thumbs up and a smile.
Did he?
As soon as we walked into the room.
The other two things you mentioned was multidisciplinary and expertise. So give me examples. These are words, you know, they're just words, but what do they mean?
Everybody has a role within this team, and they all know their role extremely well, and they are all allowed to work to their capacity and work together as a team.
How could you tell?
I could just see. You can see they converse with you. They tell you how things are going. One nurse will step forward, then step back. The other one will come forward with their role. They all move within the Burns unit so fluently and together. They know each other's roles.
Would you give Carmen a round of applause, please? Come forward, Dad. Now, the family have warned me that Greg has got a lot to say.
Never short of a word.
And I'm very pleased because his shoes are so incredibly clean. I don't know if the cameraman... City people don't know how to clean a pair of leather shoes. You said, Julie, make sure you give me a chance to say thank you. So say it now so I don't lose the chance. Well, who do you want to thank? I never let go.
As a family, I think we owe Concord Burns Unit an invaluable debt, something we'll never pay because they gave us back Angus. It was one of those things that, you know, that dedication to the team had. They were led from the top, and everybody was on the same page.
How could you tell? Give me an example.
They must only have one hymn book there because they all sang the same song. It was, everybody knew what to do. Everybody knew, you know, where they were, where Angus's progress was up to. You know, it was the physios, it was the occupational therapists, the nursing staff, the pain management people. They must have some sort of telepathic sort of connection because it was all so together.
That's a very 21st century skill, telepathy. I'm not sure how Teresa's managed to do that. You called it coordinated determination. You've given us a sense of coordination. Tell us about determination, but look that way so they can see your face as well.
It's a determination that I think they all turn up to work with every morning. The whole of the staff of the Concord's Burns Unit, from the doctors all the way through to the nursing staff to everybody that was involved with Angus, they were determined to see success. They wanted to see him walk out of there, and they wanted to see him walk out of there as quickly as possible with minimal effect. And have a look at him. You know, it's amazing. You know, they have achieved this, and it was that determination that they all had, and they all achieved, and they smiled, and they were nice, and they were compassionate, and they were very caring all the way along. You know, it was like one huge family looking to after one of their own. It was just amazing.
Could you give him a round of applause, guys? Sue, come forward, come forward. I've just got to watch the time, which is cruel. Introduce yourself. Who are you? What do you do? And big voice.
My name's Sue, and I'm a nurse in the Concord Burns Unit, and I coordinate the care of patients in the intensive care unit.
And so you're like the liaison. She's like the anchor woman, aren't you? Helping everybody talk to each other. What made that boy survive?
We share a common vision. That vision is that burns can only be healed through the mind and body. We are also a dynamic can-do team that work together, respect each other, and also we just bring in that family and the patient just from the word go.
This family, I've been out to the Burns Unit before today, and I've met the team members at the Burns Unit, and you said they were a bloody good family. What does that mean?
They were there, they were supportive, they encouraged, they were just there the whole time, and certainly that really helped Angus over the line.
Why?
He had a reason for being. You know, he could get out of bed. It made him get out of bed. It made him eat. It was, they were just there that just helped them.
I know for a fact it wasn't his spirit and his family. This is the man who got him out of bed. I'd like to, will you introduce yourself?
My name is Frank. I'm the senior physio in the Burns Unit at Concord Hospital.
I was told that he came to your bed, Angus. I don't know if you... Well, can you remember the first time you met this bloke? Come over here, run towards me. What happened?
So Frank came in one morning. He looked at me sitting in the chair and he said, "Righto, Angus, we're going to walk today."
How long was it after you got there? Do you remember roughly?
It would have been within a couple of weeks. So it was after my second lot of surgery.
And what did you think when he said you were going to walk?
I didn't really believe it at the time. So he marched over the chair, gave me a bear hug, sat me on my feet and went, "Walk."
Okay, now I mean, just physically do what you did, right? So he's in a bed, is he? What did he do? It was 7 days, Dad said, 7 days. Greg is just yelling out that it was 7 days. So what do you think is the reason this young man made it?
Well, this young man is very determined and actually quite positive.
Yeah.
Patient's success in the recovery is the main point, and the family is excellent and they are very supportive.
When I met you, you said that Angus did everything we asked him.
Yes, in the rehabilitation of burns involve a lot of pain, so a lot of patients, they really actually avoid pain. But Angus, knowing that even with the pain, he's cooperating with the team.
How did you come forward? How did you cope with the pain?
It was just something that you had to push through. You know, if you didn't, you weren't going to get better.
So there was tons of pain relief. I understand there was one day they said, "What's your pain?" The dreaded 1 to 10, and you said 30.
Yes, that was after a major operation, and we did a dressing change, and wasn't much fun. No, but that's just, it's something you've got to put up with.
They hit you with a lot of stuff, I assume pain relief, and then you came back and said it was now 15, and they considered that progress.
Yes, yeah, no, that was, so we'd halve the pain, so that was great. Still not quite within the 10, but we ended up getting there.
Pip, can you come forward? Pip is Angus's sister, and who was, yes, thank you, come forward so everyone can stare at you. It's interesting, when I asked you what made him survive, you said the positivity of the staff, nothing was an issue, and Angus's dedication. What do you mean, the positivity of the staff?
Well, we all have bad days, but Angus's whole treatment was probably a day from hell. But the staff never let that affect them. They, like Frank, made him get up, you know, do the work, made him do what he needed to do to get out of there.
And do you think that helped your brother, or do you think he's by nature a positive bloke?
Oh, Angus is definitely positive. His humour, nothing fazed him. He said, "Oh, don't worry, I'll be out of here in 3 weeks."
How long were you in?
It was 9.5 weeks, so not quite the 3.
They've made a movie, evidently. I've got limited time, but can nursing unit manager Chris Parker hurl forward? You say, when I met you at the hospital, you said your team have humility. They know when to call in others. Can you speak to that?
I think it's the fact that you know what you know and your level of expertise, and you know when to bring in the other disciplines. Any of our patients might have between 11 and 22 disciplines working on any patient. So well over 60 staff in our core team.
You said that the team is very involved, and I think we've had that conveyed in spades, but they're not competitive. I would be naive if we thought that every team works in the manner that this team is being described. Is there something about the extremity of need of burns that makes people to get this culture at Concord, or is it something else that's made this culture possible?
I think it's everybody's got that common goal. Everybody just wants to do the best for that patient. And anyone we bring in always is on the same side. It's all got the same goal.
When you see him standing there looking like that, what's happening in your body?
I get emotional about it because he's done so well.
It's not an easy gig you've chosen, is it, Burns? How long have you worked there?
For about 27 years.
So yes, a clap, thank you. Is staff stability part of it?
Yeah, we have a very stable team because you have to be passionate to work there.
Thank you so much. I want telemedicine to hurl forward, also known as Miranda. Miranda Pye is our clinical nurse consultant acting in telemedicine. You talked about that the team is highly motivated, that the family were highly motivated, they trusted the team and they were open to ideas. Why was telemedicine involved and how did that help Angus?
So, because...
Speak up.
Sure. 35% of our patients actually come from rural and remote communities. And so in order to support and give advice to these people, we offer a telemedicine support via video conferencing and digital images. We do 200 of these consults a month. And so things like teleconferencing help support our patients in the right place at the right time so that they get the expert service close to home. So for somebody like Angus, we're able to, particularly for the reconstructive phase and for his transition back home, touch base with digital images and provide that support and advice for his wound care.
Carmen, come forward, darling. So what's happening at your end? How did this help?
Well, that's our laundry. we turned our laundry into a stores area, and our kitchen table became our, not an operating theatre, but where we bandaged Angus every day. So being able to communicate back with the Burns unit on a daily basis, asking them about the myriad of bandages that we needed to use and lotions and potions, and being able to send photos and ask them questions about how they think it's healing, and the fact that it is healing and they can see progress.
Darling, what do people do? Thank you, Carmen. What come forward? Give us a round of applause for Carmen. What on earth happens to people who don't have a family like this?
Well, we look after people in their homes, and yes, not everyone is lucky to have a great family like Angus, but there are so many wonderful health professionals such as yourselves in other settings, whether it's a Aboriginal medical service, a nursing home, and even a correctional facility. We're able to link in with these people and give them that expert burn support that they need in real time.
So you take the same positive approach and expect them to survive and live like everybody else?
It's not just about surviving though, Julie. It's about getting the best possible outcome and the best functional outcome, because I would want to be treated, and everyone should be treated equitably, I can't say it.
Equally.
Thank you. Equally, irrespective of their geographical location.
Look, thank you, Miranda, so much. And Izzy, if you could come forward. Brought the doctor last only because I'm highlighting the incredible role of the whole team in making a young man like this survive. But can you introduce yourself and explain what you do? I never let go.
I'm Andrea Isler-Fisher, and you saw that video of me before.
Could you speak really loudly? What do you do? What is laser, burn and reconstructive surgery? What do you do that helps people look like that after hideous burns?
So I run the SCAR clinic together with Professor Mates, where we see the patients once their wounds are closed, and then we evaluate and assess their scars and establish a treatment plan individually for every patient. And in that we combine modern laser technology which actually helps or enables the body to heal itself, and then combine this with small surgical reconstructive procedures. And the whole point about that is that we do something minimally invasive and not big procedures that gets the patients quickly back to reintegrated in their previous life, improve symptoms and function, cosmesis.
Makes it sound that time is not only of the essence getting the patient to the team, but you still work to keep the person progressing, that's a big part of what you're up to?
Yes, so in a burn injury, there are two phases. So there's obviously the initial phase where Angus was for 9.5 weeks in the hospital, but then the whole aftercare comes with all the little wounds we saw before, which needed to be addressed at home, then occupational therapy, scar management, and that's an ongoing process for quite a while after an injury.
Sorry it's been so brief, but she does look good in scrubs. Can I just bring forward my Sue, because I've now spoken to everybody, haven't I, because my time is up. What message, what's one or two things you want your colleagues to take away from what we've just heard? What do we learn from all this?
I guess Angus did really, really well because he came to our hospital within within 12 hours. And we were able to assess and start his treatment within that time, and surgery the following day. So I guess, airlifting to our hospital was just paramount for his great outcome.
And you land him on the grass.
That's right, yes.
And the ambo pulls up beside the grass.
Yeah, so it is like a country hospital.
There's stuff about the redevelopment on a board over there, but it is, I've just seen the image, and when I saw they're actually landing on the grass, I thought, this is amazing. Look, can I just say, on behalf of everyone here, isn't it great to see something working well? It's so uplifting, and congratulations to Angus and his family for your incredible dedication. People sometimes call it compliance, but I call it dedication. So could you give them all a big round of applause?